Hi, everyone. We're going to talk a little bit about atherosclerosis and coronary artery disease today. This is another one of those kind of big subjects that you want to have a really good grasp of before you go into your NCLEX, into practice, and basically into any kind of exam that you're going to be taking. So it's something that maybe for the NCLEX or for, nursing care in general, you may not need to understand, for example, how these free radicals are oxidizing, low density lipoprotein and so on and so on. But understanding what's going on underneath kind of those symptoms and manifestations that you're used to is really, really helpful just in kind of just being able to put things together in your head. It's what will help you answer questions on the NCLEX, even though, no, you're not going to have a question that's going to specifically be asking you about, oxidization of LDL. But knowing that is going to possibly guide you to the right answer. So it's something you want to keep in the back of your mind. But also for if you're studying for example, for a school exam, now they're going to ask you these questions, right? So let's go we'll go as deep as we can without going too crazy. People don't want to go down into organic chemistry levels, but let's break it down and give you what you need to know to pass basically a nursing exam and definitely the NCLEX. So atherosclerosis, those of you who know me know that I love to break down medical words. So let's talk about what this word means here. Athero is kind of this fatty, mushy, like soft, pasty material. That's basically what that means. And then scleros is hardening. So anytime you see sclerotic disease or sclerosis or what have you, we're talking about hardening of something. So atherosclerosis on its own is this kind of, it's a process of this fat, which we'll talk about. It's basically low density lipoprotein. We'll talk about that later. Is building up inside the wall of an artery. It builds up over time. If you look up over here, and then it causes kind of disruption in blood flow. So if you look at this artery up here, you can see, let's say this right here is your atherosclerotic plaque. Got some on both sides here. And so it's really, really thinning kind of the lumen and the area where the blood can actually flow through. I like this drawing because it actually shows that the red blood cells they're not big enough, or they're too big to get through that little space, right? So really our big concern here is the disruption of blood flow, and then a possible rupture of that plaque and thrombus. We'll talk about what happens, how that happens, and what will happen a little bit later. For now, I'm going to go through kind of the pathogenesis or atherogenesis, kind of an overview first, because a lot of times, if I just kind of scroll over here, a lot of times I find profs will ask really specific questions about what's happening during each stage of, in this case of atherosclerosis. So I just wanted to, before we go through all this detailed stuff down here, just kind of give you a really quick overview of what's happening. Before I go on, when we're talking about coronary artery disease, right? We're talking about atherosclerosis, so the hardening and buildup of this plaque that is happening in the coronary arteries. So if you look at this little kind of faded picture of a heart that I've got here, just a quick anatomy review. That the heart pumps out the blood carries oxygen, nutrients, what have you, to the rest of your body, to all of your blood cells that need it. And then I like to basically think of oxygen. It's the easiest way for me to kind of think patho-wise or whatever. it's picking up oxygen in the lungs, it's bringing it out to wherever. I always think of like your toes and your hands, drops it off, and then comes back to get more. So when we talk about coronary arteries, the heart itself is a muscle, right? And the heart itself needs that oxygen and needs the nutrients and glucose and what have you. So how does the heart get that, right? That's where these little coronary arteries come into play. If you look here at your aortic arch, you can see at the very beginning, there are these two kind of vessels that branch out. This one here on the right would be your right coronary artery, or RCA. And this one here is your left anterior descending. Left because it's on the left, anterior because it's on the front of the heart, and it descends, right? So it's pretty easy to kind of figure out what we're talking about there. We're not going to go in and talk about all these little arteries here. But when we're talking about coronary artery disease, we're talking about the process of atherosclerosis that's happening inside of these coronary arteries. These arteries that are bringing oxygen to the heart itself. So if you have a narrowing in this lumen here, and actually you can kind of see on this picture, I think it got online, it's actually a picture of an infarct. You can see kind of the necrosis here that's being caused by this, probably an infarct in here. I've probably drawn over top of it. But. Okay, so let's talk about atherogenesis or pathogenesis. Remember that genesis is the beginning of, so let's talk about how it forms. Really, really quickly overview, in case the prof kind of asks these specific what's happening in each stage. Your first stage is going to be this damage to the endothelium. So if you look at this as a cross section of one of the coronary arteries, you can see this kind of little damage here to the endothelium. How does that happen? It's not necessarily like damage. Sometimes when we think of damage, we think of like, something physically like cutting or hurting that artery. In this case, we're talking about very subtle injury that's caused over a long period of time. It's like a repeated subtle injury, and it most often is caused by smoking, hypertension, and diabetes. We'll talk a little bit more about those risk factors later, but just so that you have an idea, those are the main things that are causing this injury to the endothelium. And remember that endothelium is just the inner layer of this vessel. We'll talk about that a little bit more as well. These are kind of hypercholesteremia and dyslipidemia are kind of risk factors, which we'll talk about. Of course, an autoimmune disorder where you have the inflammatory process kind of going crazy and maybe attacking your own body or attacking your own blood vessels can definitely cause damage to the endothelium. And then an infection can also, a lot of that has to do with your inflammatory response. So if you thought you were going to get away from that inflammatory response unit, you're never going to get away from it. So it's a really, really good thing to have a basic understanding of, again, for practice and for NCLEX and for your test. So what happens after that? You have kind of your second, or really to me, this is like your first stage, but this fatty streak that's building up. So what happens is you have all these lipids, we'll talk about where they come from, that accumulate there kind of in the muscle of like the wall of the artery. And it's kind of got this yellow tinge to it. It's going to cause a little bit of the narrowing of that lumen, but it's not, you very, very likely would not have any symptoms at this point. You've still got quite a lot of blood. Sorry, we don't want the blood going in two directions. You've got quite a lot of blood that is able to pass through the lumen, right? So over here, we get to this kind of next stage, this fibrous plaque stage. So if you look at this, your lipid core, this buildup of lipids here has grown. The endothelium hasn't been able to repair itself. So we'll talk about how that stimulates growth factors. But the idea is that the wall of the artery thickens, the blood vessel narrows, and now it's even harder to get anything, your red blood cells with oxygen or what have you through this lumen. There's at this stage, so this fibrous plaque stage is where you get the growth of that collagen over top of the fatty plaque. So your fatty streak over here has now kind of hardened to the point where there's this collagen layer on the top of it. I think depending on your textbook, they can call it like a fibrous cap or collagen cap. The idea just is that it's hardened over the top here, this collagen, okay? And that the lumen has narrowed even further, blood flow is reduced. Our very last stage here, this is by far the most dangerous, this complicated lesion. So when you get to this fibrous plaque area here, it can stay like this for quite some time, but oftentimes it will rupture, or you will have a thrombus. That's kind of what this picture here is, the thrombus formation. Sorry. That will cause that lesion, which really, guys, when we talk about lesions, it's just any kind of growth like this. Yes, we know that it's a fatty plaque, but it's still a lesion, right? So once that fibrous plaque either ruptures, it's unstable in some way, oftentimes it will grow kind of a thrombus. That's when we're in really big trouble here. There's a number of things that can happen from here. We'll talk about stroke and embolisms and so on in another video, but you get the idea that, first of all, this is blocking the entire lumen. Doesn't always block the entire lumen, but it will blocks a good chunk of the lumen. But also you've got this risk of this is now a big thrombus, right? Of some of this or all of it breaking off and traveling into some of the smaller arteries, right? And then blocking off blood flow to that area. So if you look over here, if you've got kind of a buildup here, and a piece breaks off, it might lodge itself right here. And then you've got all this area here that's going to become necrotic very, very quickly because it's not getting oxygen. When we talk about, so I know that the clotting cascade can be a difficult, not a difficult concept, but you just have to really take your time and break it down and know it. And so we're going to go through that in it later, but I just wanted to kind of go over what these glycoprotein 2B and 1A receptors are, because at this point of this complicated lesion, that's where these platelets, we'll talk about why they're there and so on. But if you look at this here, let's say this is your platelet. And you can you see these are your receptors, your glycoprotein receptors. These are what binds to this little guy here, which is your fibrinogen. Your fibrinogen is what, if you look, when it binds, it's what kind of binds your platelets together, right? So you'd imagine there'd be another one here, there'd be another one here. So these receptors are really, really, really important when it comes to platelet aggregation, right? Remember, this isn't the fibrin stage. Remember we talked about those fibrin strands that come and form, and don't worry, we will talk about it again in a later video, but this is where we want, this is where they're just originally kind of coming together and aggregating, right? And the reason this is important is because this is a place where we can kind of stop that cascade or stop the thrombus from forming. But the idea is that you've got all these exposed platelets here, and all those glycoprotein receptors, right, that are expressed or open or waiting, ready to work, binding to fibrinogen, and then causing this platelet aggregation and adhesion, and then really a thrombus or increased risk for a thrombus. So don't worry if that's, this whole thing is going to seem like a little bit much right now, because we don't necessarily understand how each of these steps is happening. Like I said, I just wanted to go through, kind of give you an overview of each step so that you can have that as a frame when we're going through each one of the steps following, and so that you can answer whatever question your prof might ask you about the specific stages. So as we're going through the next, I'm going to break down each one of these phases for you, and I'm going to come back and relate it to this, so okay, this is happening during this stage, or it's happening during, this stage. So we're going to do that in the next video. So hang tight, and we'll see you in a bit.